Welcome back, beautiful tri-state area. You're listening to a moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Up next in our Going Deep segment, brought to you by CO2 Lift, in our Expert on the Microphone series, we're featuring Dr. Kimberly Evans. She's a board-certified OBGYN with over 22 years of experience in feminine health. She's revolutionized her practice to specialize in treating women with sexual dysfunction, low libido, and feminine wellness issues. She offers surgical and non surgical options. She sure knows her stuff. She's a member of all the majors: the American College of Obstetrics and Gynecology, American Medical Spa, Aesthetic Multi-Specialty Society, the International Society of Cosmetogynecology. That's just to name a few. And then to top it off, she's a keynote speaker across the major derm and aesthetic conferences. Today, she joins me to chat about sexual dysfunctions, feminine wellness, and evidence-backed treatments that will reignite the bedroom scene. Welcoming now to the show is the beautiful Dr. Kimberly Evans. Welcome to the show, Stunner.
Oh, thank you. Look who's talking. God bless you. How are you doing today?
So excited to chat with you. I'm doing great. Okay, let's dive right in. Interestingly enough, there was a study published in the Journal of Sexual Medicine. Approximately 43% of women experience some form of sexual dysfunction. Now, this research suggests that psychological factors like stress and depression can significantly impact the woman's sexual health. And we know that around 10 to 20% of cases are attributed to psychological causes. Dr. Evans, in your extensive experience, what are the most common sexual dysfunctions that you encounter in your practice? And what are some lesser known factors that can contribute to these sexual dysfunctions?
Absolutely. One of the key things I always tell my lady is that as we age, your bodies are going to change. So how you feel about yourself, how you look, your hormones change. All those things contribute to, aging and having that lower libido status. And of course, because that's how you then show that to your partner, that in turn is how your partner reacts. So long story short, key things like low energy, lower hormones, they all contribute to lower libido as well as vaginal laxity. So those are all important things when it comes to dealing with women's sexual health issues.
It's interesting because statistics and surveys are at the basis of a lot of the work that you do. But one of the surveys conducted by the American College of Obstetricians and Gynecologists found that while many women are open to discussing sexual health concerns with their healthcare providers, less than half actually do so. So there's still shame and stigma in addressing these issues. So how do you approach sexual dysfunction treatments and feminine wellness issues when considering both the surgical and the non-surgical options?
Absolutely. Key thing is to figure out, I start all my conversations with, how can I help you? So having that provider that listens, that understands, that opens the door to let them know that, hey, there's a lot of women that are suffering. A lot of women actually don't say that they're suffering. They're like, oh, I'm fine. There's no problems, when really at home, they're secretly suffering. So having a variety of things and saying, hey, it's okay to open the door and not make this a taboo subject. That's huge in just being able to address these issues. So first thing is just opening the door to, how can I help you?
Well, I think that's a great start because even most doctors, they skip that part, right? They go straight into what are the tangible malfunctions of a human body, and then they address those without really going into, looking under the hood. And it's funny because the global market, right, for feminine sexual wellness products is projected to reach $4.6 billion by the year 2025, indicating this really growing demand for innovative solutions in this area. So it's going to bring me to the next topic: carbon dioxide therapy for vaginal rejuvenation. Studies have shown that carbon dioxide therapy, and you know this better than anyone, can improve vaginal laxity and dryness and urinary incontinence in women with a reported satisfaction rate of over 90% among patients. Could you explain how carbon dioxide therapy works for vaginal rejuvenation and what specific benefits it offers compared to other treatments?
Absolutely. So the carboxy therapy is really cool. In a nutshell, what happens is that when you apply the carboxy therapy, it tricks the body into thinking that it has a low oxygen state. So in that state, your body naturally responds by causing vasodilation. Vasodilation helps increase the blood flow to the area. It helps with healing. It helps with making more moisture, adding more sensitivity. So it's like a little mini facelift for the vulva. So in a nutshell, that's how it works. But what's also cool is that it can actually be combined with multiple therapies and modalities. So things, such as like the O shot, things such as radiofrequency Ep160, or even affecting those muscles with things like the IMSLA, or even hormone balancing. It can really complement and actually enhance what you're already doing to get even more of a beneficial effect. So I love using a combination of these therapies to really help optimize what we're doing for these ladies.
Combo therapies are
Mhm.
definitely on the rise. I actually used the CO2 Lift V. It lifted, it hydrated, it
Yep.
rejuvenated in just 3 applications. It was phenomenal, like nothing I've ever seen before, and I even had an encounter with my husband. He's like, "You look tighter." I was like, "Well, thank you for noticing." It was
That is
CO2.
that's correct. Yes, yes. When we ran the study, we did a recent study on it with Dr. Libichoff and Dr. Red Allenside, and literally on that study, it proved that yes, there is not only an enhancement, but the ladies were coming back. This is like a it was a great study. It was randomized. I didn't know which if the patient had the placebo or the actual drug, and the patient didn't know. But when they were coming back saying, "Hey, you're right," my husband noticed. Everybody noticed, and they were like, "What did you do?" It was just phenomenal experience for the ladies to feel better.
Yeah, totally. And
Mhm.
clinical data suggests that combining, to your point, carbon dioxide therapy with other modalities, and this is again clinical data, such as
Mhm.
hormone therapy, right? Or the pelvic floor exercises. We had the vagina whisperer on. She was talking about pelvic floor exercises. Those
Yes.
can lead to synergistic effects and improved outcomes for women seeking comprehensive treatments for vaginal rejuvenation and sexual health issues. Now, carboxytherapy, let's go back. How does carboxytherapy complement? Because you just said in combo therapies, how does it complement or enhance other treatments for feminine wellness or dysfunction that you offer in your practice?
Absolutely. So for a lot of ladies, the reasons why they're coming in, it's kind of compounded. Like some ladies complain of lower libido. Some ladies complain of pain during intercourse. Some ladies are breast cancer survivors. Some ladies, they have other issues that are going on. But the key is to, when talking to them, figure out, exactly what are they suffering from. And then to say, okay, great. Now, you're someone who can have hormones, or you're someone who can't have hormones. So for the people that can't have any hormones, here go their carboxytherapy. Or say, for instance, with someone with urinary incontinence, so we would actually combine that electromagnetic, the IMSLA machine with that in order to help her with incontinence. But then she can also say, but hey, I need a little lift too. So then during those treatments, she's also doing her carboxytherapy in combination. So it's kind of like you're getting the 2-in-1 effect, or definitely more of an enhanced effect.
And I love that you're all about clinical research.
Totally.
70%, over 70% of women who typically seek treatment for sexual dysfunction
Mhm.
reported improvements after receiving, and we're talking about evidence-based intervention. So and again, the way we learn how to prevent, diagnose, and treat illness is via clinical research. Many different elements of scientific investigation are involved, and it involves human participants and helps translate basic research done in labs into new treatments and information to benefit parents. So, what is your expectation as a provider on clinical research, and what studies? You mentioned the study for the V, but have you conducted any subsequent studies involving the CO2 lift V?
Yes, not yet, since that study just started. But the key thing is that, we as providers, having a medical practice as well as a medical spa, and being able to combine those, we want the best of the best. We want the best treatments that's study driven. So if I'm combining something that I know that works, and you can only enhance the results. This is of course, it's the most valuable for the people, because really it's an investment. It's an investment in your body. It's an investment in, if I say, hey, this is going to help you with OSHOT, I'm sorry, with having orgasms, and also enhance the way that it looks. I want stuff that works. So that's how we're able to do it in our practice.
And let's go one step further. Are
Mhm.
there any potential risks or side effects associated with carbon dioxide therapy for vaginal rejuvenation?
Yeah, great question. Only a little bit of mild irritation and sometimes redness. But what we also see is an increase in sensitivity in the area too, which can then also lead to enhancement in orgasms. So usually, again, the side effects are very minimal. It's very easy as a gynecologist to treat most of these things. But literally the data, what the patients are saying, what their spouses are saying, it's all positive stuff. So it was really like a good. It's a great study.
Great. Love it. I'm sold. I'm sold. Now, without a doubt, a multidisciplinary approach that involves collaboration between gynecologists, psychologists, physical therapists, and other healthcare professionals definitely leads to more comprehensive and effective treatment outcomes for women with sexual dysfunctions. Now, Dr. Evans, what role do you see interdisciplinary collaboration playing in the field of feminine wellness and sexual health?
Absolutely. So the feminine wellness, the whole space is fairly new. No longer is it just, you can only take vaginal estrogen and you just have to be happy with that. And no longer is it that, women, they don't have choices or options that are out there. There's a whole ton of stuff that are out there that are definitely study proven. With a lot of my patients, a lot of them actually have their own gynecologist, and then they meet me and I get to say, hey, I'm the fun doctor because I'm going to take, we're all working together. We're all on your team. We all want what's best for you, but how can we enhance what's already going on to make you better and you feel more whole?
It sounds like you're a psychologist on top of everything else.
Oh, no, 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 no. No, we just, I love what we do. I think with everything, getting older sucks, but it honestly, I tell my patients, it doesn't have to. It doesn't have to suck as bad. We're here for a reason, and I feel very blessed just to be able to provide the service that we do.
Well, you are amazing, a pioneer in your field, a trailblazer. We are at the end of our interview. Thank you so much for coming on and being so transparent and explaining it all and giving us so much insight.
Mhm. Thank you so much. It's my pleasure. Thank you so much for having me.
Guys, truly proprietary products. When infused into the skin, CO2 immediately diffuses at the cutaneous and muscular microcirculatory levels, resulting in higher tissue oxygenation. The good doctor just said it herself. The blood vessels widen, increasing the transport of oxygen body tissues for cellular regeneration and anti-inflammatory effects. The science is the science is the science. You have to head to co2lift.com to check out these amazing products. That was our Going Deep segment, and that was the amazing Dr. Kimberly Evans. Check her out on the gram at Dr. Kimberly Evans or at GYN Diva. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.